So when we say digital health, basically what exactly comes to our mind is basically is how the technology is affecting or enhancing or impacting our health and well-being. And today's presentation is basically mainly focusing on India perspective, not like what the whole world is doing with the digital technology and all, but how the digital health and why it is so important for us in India. And because the scenario in India is so different from the world, which I will explain in my slides, that and what is happening in India is most of the time we are blindly copying, whatever is being done in the US and Europe. So same thing is happening for our health sector also. And this COVID situation has basically shown us that no matter how good their healthcare systems are, but they still does not work. And if we blindly copy the same thing in India, it is certainly not going to be any help for Indian population. So with this note, I'll just, so before I talk about digital health, let's see what is happening in India in last 4 years, 4 or 5 years. So the government has basically taken this big initiative of Digital India, power to empower. And with this, in last 4 years, what has happened is basically, you can actually, all of us have experienced the Digital India by whether we are using using Paytm, or whether we are using Aadhaar card to identify ourselves, or we are using, there are many services, like almost 2,300 services available through various platforms like MyGov and PIN app, and there are so many initiatives in every sector, whether it's education, whether it's your manufacturing, or whether it's identity and verification. There are so many services are available, and it is continuously being added. And just one data says that 123 crore people have been provided biometric identity and seamless access to many government services, which is a huge slap. Like if you see India, and 5 years before and now is like all of us might be using DigiLocker to have and on the mobile we can just produce our identity card like PAN card, or if you are having a motor vehicle, so your motor vehicle documents are, you don't need to carry anymore. You can just open DigiLocker and show it to the police and everything. So the way we have been dealing with the day-to-day life 5 years and now has completely changed. So Digital India is basically, you can see what happened with the Digital India. Now the current scenario is basically even the rural population has, number of users has increased in rural population. So you see 227 million users are in rural India, internet users, just compared to 205 million users in urban India. So this is very encouraging data. Why I'm sharing this data is basically, this is what the foundation is, where the digital health can be maximized. Use of digital health can be maximized, and it's not only for the urban population, but it can be equally good for rural population. And India is still so. And if you see the internet uses, basically 65% of the population is using internet every day, which is like a very encouraging number. But what is not so encouraging is if you see the way they are using the internet. So mostly, if you see the rural population, they are using internet for entertainment. They are using for social media. There is a little bit on communication, online shopping very little, and online ticketing is little less. So that is where the thing is, we would want to see that the internet is being used for education, internet is being used for healthcare, internet is being used for, so those are the things where we are still, in next few years we will see that those changes. So now let's talk about, so once the context is set, I mean, we can now talk about, so my presentation is basically structured in, we will talk about the digital health, what is digital health, what are the opportunities we have, and then healthcare in India specifically, and what are the challenges we have in healthcare here, and what are the way forward. So this is like, these are like very 4 areas I will be going into, and along the way we will also share some of the experiences with I2IT and Codex how. So as ma'am told about Codex, so my little bit on, I will highlight on Codex services. So Codex is mainly having more than 20 years of experience in providing medical technology consulting. When I say medical technology consulting, is basically if there's a hospital, so doctors, they know how to treat you, but doctors, they don't know how to set up the facility, which technology, what equipments are needed, and so how the hospital has to be constructed, how the equipment has to be installed, and how the facilities has to be operational. So this is the medical technology consulting where Codex plays major role. Almost more than 150 hospitals in India we have provided our services in, like whether it is like technology consulting, whether it is procurement consulting, whether it is financing feasibility consulting. So these are the main areas our consultants deal with the hospitals. So what is digital health? Just a definition for you to understand. I mean, I'm sure you must have understood what is digital health. So digital health is basically, I'll just read it out, using technology to help improve individuals' health and wellness. It can cover everything from wearable gadgets to ingestible sensors, from mobile health apps to artificial intelligence, from robotic carers to electronic recalls. I mean, it's about applying digital transformation through disruptive technologies and cultural change to the healthcare sector. To understand the digital health is very simple. Like if you have ever consulted a doctor using your phone or using your WhatsApp, using your any video call of WhatsApp, and doctor has prescribed you some medicine, basically you have used digital health. So this is basically the technology, intervention of technology to improve our health and wellness. That's where the digital health is basically. Now, you see what is happening in last few years is like digital transformation has changed our lives, be it our mobile devices, be it connected home, be it automotive. I mean, you see Tesla has, done the fully automated car, right? The car drives itself. That's the kind of transformation. Uber. So there's this whole life has been impacted with the digital transformation in last few years. Some of the disruptive technologies we have all seen how the taxi industry changed, how with Uber and Ola, how the hotel industry changed with Airbnb, how this online shopping, like whole shopping experience changed because of this Flipkart or Amazon or eBay. Now, so this is basically the technology is empowering us. At the same time, technology has basically taken over many of the things which were like done like very manual way. So one just example I can tell you about how the social media is impacting the healthcare. Now this is like mind blowing. So there are research and there are technologies. By just analyzing your Facebook posts, they are able to predict medical conditions. Like almost 70 different types of medical conditions are being tracked using your by analyzing your Facebook and social media posts. Okay, so this is how the technology can be used. We are all on social media, we are all on WhatsApp, we are all on e-commerce. I mean, these are we are all taking online classes right now. This new trend has started, that online classes. So if there is a way to analyze those data on internet, then there are so many things which can be predicted, and mental health is one of the most critical problem in this current generation, that so many at the age of students are suffering with medical conditions. So there is a big opportunity here for many players to come in, use the data available on internet, and contribute to improve our health and wellness. Other things which are basically again changing our life is these mobile devices and tracking devices, wearables. We all have seen that smartwatch, we all have seen MI fitness band, Fitbits, even shoes are now with sensors, and it records how much you have walked, how many steps you walked, how much you jogged, and everything. There's so much happening. Then there are tracking devices like senior care, they can detect the fall in your house. Like if you're wearing a device, and senior people, mostly they have a fall in let's say in the bathroom, and nobody can basically find out. But this tracking device sends alert to different mobile phones, subscribe to it, and immediately you can take action and rescue the person who has fallen. So all that is basically has really there's so much. Basically, what I'm trying to say, there's so many different ways where the digital technologies can improve our health situation. So now, what are the opportunities are there in digital health? So in India, of course, this Digital India initiative is a big boost for the entrepreneurs and business people and hospitals to jump into digital health initiatives. And thanks to this Corona and situation, government has legalized telehealth practices. So telehealth practices is basically, you don't need to go to see the doctor. You can get the treatment done sitting at home, and this exactly is what this doctors are and authorities are advising you to do now in the Corona. They are requesting you to stay home and call the doctor. Don't come to hospital. So this is the perfect time for taking all these digital initiatives and improving the healthcare. Now, see the market. Just one slide I have kept just to show you the money involved in global digital health market. So this is 500 billion is expected by 2025. That's the market size for digital health. Now, what all is included in this is basically there's M health, that is mobile health, digital health system technologies, which can be telemedicine platforms, health management system, hospital management systems. Then M health is basically where all these wearables comes in. So, so the market size and the growth is so good. If you see, the growth is 30% growth per year. Right, so it's a big market, and big players wants to be in this market. If you just look at Asia, Asia is the biggest market in terms of health sector, because Asia has the biggest poor population and the health sector is completely unorganized. So there's opportunity to for small players, big players, manufacturers of medical devices, manufacturer of software services. Every player can, even the entrepreneurs can come up with sensors or devices which can be part of this, and they can make good if business out of this, because of the market is matured, market is there. You have to, everything is favorable for you to start anything, any business in digital health market. Okay, so this is just an example. Digital health is where big tech firms want to be right now, with IT firms scrambling to up their presence in the digital health, right? You see the Tim Cook, he basically said that in future the company's greatest contribution to humanity would be considered to be about health. So this is the seriousness of these big tech companies, and Apple Watch is the best example to understand how serious Apple is about healthcare. So they have launched Health Kit platform and health app. So Apple Watch is now, when doctors are referring to Apple Watch, and Apple Watch is able to monitor your heart in real time and like alert you if there is any irregularities it finds. And the best thing is that, like there are two different things here which I want to highlight. Is basically medical devices and wearable devices. They are. So medical professionals will not accept the data which is generated by your wearable devices. This is a big, because medical professionals are trained in that way, and they do not rely on your devices because those devices are not proven. So the data whichever your mobile phone is generating or Apple Watch is generating is really, they will not consider it 100%. They will say, okay, it's just an indication, but they will again go for the whole test. And that's where Apple is trying to, bring the impact by getting all kind of certifications and approvals, and making that medical professionals believe that whatever Apple Watch data is, it can be treated as official health data for diagnosis. So that is the big move from Apple. And there's another initiative. Apple is also working with one company that creates medical products to track how people are recovering from a surgery. You imagine your phone and your Apple Watch is basically monitoring your recovery. So how amazing is that? So, and any complication happens in your post-recovery, which happens a lot actually, and then your doctors are alerted immediately, and a timely intervention will basically, help you recover faster, right? So these are the some of the very exciting and encouraging initiatives which should basically motivate us in India to take the digital health seriously and come up with some innovative products and solutions. So basically every company, if you see Microsoft, Google, Facebook, Amazon, these are the 4 big tech companies at the moment, and they're all already in digital health space. So there are n number of services they are providing to direct to hospitals, then to the entrepreneurs or health tech companies can utilize the platform like health AI and IoTs and everything they are providing you so that you can quickly build your solution and go to the market. Okay, so the challenge what we have in India is basically to provide quality healthcare to 1.3 billion population. That is the population we are talking about, and how to make that possible. And to understand that current scenario and challenges we have in India, I will basically look at 4 different aspects here. 5, India demographics, how the population of India is scattered and what are the facilities they get, where they get. Now, even do we have access to even basic healthcare in India? And then we'll see what's the quality healthcare. Basically, there's a big difference between just getting access to healthcare and then getting access to quality healthcare. Like in India, if you move just 50 kilometers from a metro city, the quality of healthcare decreases by almost 80%. So if you are in Pune, you move out, let's say 50, 60 kilometers, and then you see what you get. As if you get sick, you will find a doctor who is a local doctor who is not even trained for any basic first aid kind of treatment. So that's the biggest problem we have of access to quality healthcare. And then Indian healthcare is cost of basic healthcare. So usually what happens is we have most of the cases time it's out of the pocket expense is in the healthcare that we like 90% of the poorest probably are not having any health insurance to cover their medical expenses. And even if you let's say if you have coverage, but it's so complicated. Like if you are going to see a doctor in a clinic, or if you're going to just get a doctor consultation on phone, the insurance people will say no, it is not covered in your plan. So basically 60 to 70% of your medical expense is basically out of pocket. So let's look at the demographics first. Like what is the population ratio we have here, urban versus rural population. So India is like still 60%, more than 60% is, almost 65% is rural population. Now, you see the healthcare facilities are basically 75% of dispensaries, 60% of hospitals, and 80% of doctors are located in urban areas only. That means this whole thing is serving only 34.5% population of India. Now, what happens to healthcare for 65% people of rural population? So that is a big challenge for us here. Right? So healthcare, you see this. Just see this: 11% of sub-centers, 13% of PHCs, and 16% of CHCs meet the Indian public health records. Forget about World Health Organization standard. I mean, this is so even if there is a clinic available in your village, but the quality of service, quality of healthcare you get is basically, you can see. So what we have currently is basically not sufficient, and whatever we have is not, like, there is no quality in it, right? Like the data is so scary. Like some of them who are providing you medical care does not even have a school diploma, right? So this is very scary. Now coming to access to quality healthcare. Now this data is even more scary in India. So like 2.4 million Indians die out of treatable conditions, but because they could not get access to quality healthcare, they die. So 1.6 million out of 2.4 million, they basically got some healthcare access, but because of the quality was so bad, they could not survive. Right? So this is like almost 122 Indians per 100,000 die due to poor quality of healthcare. That's the scary number we have in India. I mean, we are focusing so much on Corona now, but you see already so many people are dying in India every day, every month, every year because of the poor quality of healthcare. Okay. So this is the where I mean we need to have our businesses and our entrepreneurs think that how they can take advantage of digital India and digital health and improve this situation and reduce the number of casualties. Right? Not only that, but there is, because of this healthcare, poor healthcare, we have serious loss of economy in trillions, And the thing is that suffering the family and the survival people are going through is enormous. It's like, it's mind-blowing. Then lack of trust in the healthcare system. So what happens is eventually, because of this poor healthcare service you get, you lose trust in your healthcare system. And that is a big loss for the industry, that is a big loss for the population, that is a big loss for our society, happiness and everything. So everything gets bad, like you get stress, you get sick, and the population is basically not happy and healthy, right? So again, this because of this quality, poor quality of healthcare, 81% of heart attacks, like deaths, 81% of vaccine preventable disease. So much is just because the healthcare quality is so bad, right? So it's just this number, which is basically, you need to remember this so that you know what I'm going to talk like next. Now, another big challenge here in India is the shortage of qualified doctors. So this is the study, one of the studies saying that we have shortage of 600,000 doctors and 2 million nurses, which is like, so in India, we have 0.25, like not even one bed per 1,000 population. And if you talk about seniors, the same situation. And this is the data which is basically across India. Only a little bit is better in the south part of India. Otherwise, whole of the India is in a pretty much shortage. Okay. Now, cost of basic healthcare is basically every year, more than 60 million population is forced into poverty because of their health expenditure. That's really a concern. So our healthcare is not well structured. Insurance is not yet utilized in a way it should be utilized. So this is like another big area and another challenge for how our digital initiatives can fix those gaps between the healthcare provider and insurance provider, so that out-of-pocket expenses can be minimized. Now, this is another very basic thing, but so important, is that access to our health records. We don't have readily access to our health records. Like, for example, for me, I have lived in almost 10 to 15 years in Thailand, 1 year in Singapore, and now I'm in India. But if I have to find my health record for the last 10 years, I don't have it. It is with the hospitals, it is with the doctors, and I'm here, but I can't. So this is my, access to your health records is like you should be owning it, but it is owned by hospitals and medical service providers. So even simple basic data, like in case of emergency, if you are brought to hospital, I mean, there is no way for the doctor to immediately know your blood group, what are the allergies you have. And every second matters in case of emergency, right? And let's say, imagine if I mean, every year I have been going through my medical tests, right? Like simple blood tests for, like health records. But I don't have it in a way where I can analyze this. Like if I have data of my health data for last 15 years, 10 years, and if you can see the analysis, probably it can indicate you some of the conditions you might be, getting into, and you can immediately take the preventive measures and not fall sick and get into a big mess, right? So the health records are so important, but in India, it's like, it's a dream, like, that to have your medical records and health records and medical test reports organized and available, and to be able to analyze those data. So this is again a big opportunity for, here where the digital initiative can really fill the gap. So now, after we understand what is digital health and how, what are the challenges we have in India, so what are the way forwards? So basically, if you see what we basically need to think is that patients should be taken care of. Everything else will fall in place, right? And the touch points are patient doctor, then patient doctor touch point is on teleconsultation. Then there is a doctor to doctor touch point where they can consult to each other. Then there is patient monitoring, like if we am talking about healthcare at home, for example, so there is a need to monitor the patient 24/7. So these are the main touch points where the digital initiatives can really bring in lots of improvements in the healthcare quality. Okay, so India Healthcare 2030 and beyond. Let's see what they have to say. Some of the prominent figures in Indian healthcare and what they are saying, basically, they are all indicating that we have to use the technology in the best possible way. So for example, this Dr. Ravi Ganesh, who is the CEO of Cloud9 Group of Hospitals, says, when we have limited resources and limited supply of skilled caregivers, it is necessary to find ways to use the technology, right? So this is like, again, Fortis Hospital, Dr. Ashutosh, there needs to be a system where we can focus on skilling and upgrade medical workforce skills. So he's talking about how can we have a better training programs, online training programs, skill development programs, and which can be basically even the remote workers and nurses can basically skill themselves to provide better healthcare. Right? Like Dr. Naresh Trehan, it's like he's talking about the again, to maximize benefits, it may be wise to establish a link among various health initiatives announced in the budget. So he's saying, of course, there are many initiatives, but those are not linked. So it's not federated kind of environment where I have freedom to move, and like insurance is not linked with my health card. So this whole mess out there, and they are all basically saying the same thing, that maximize the use of technology. Sumit Goel, another KPMG, his digital tools can make clinical expertise available either remotely or through expertise embedded in medical equipments. So digital tools. So all indication is basically to maximize the use of digital technologies. Right. Now, let's see some of the very basic examples of how the technology can basically help us in improving and getting the healthcare. So one is the telehealth. We are all talking about telehealth. So telehealth is very simple, but that you are sitting at home and you have access to your doctor in the hospital through a video call, through a chat, through an audio call. And the doctor is able to check your conditions, and doctor is able to prescribe the medicines, and that prescription is sent to the pharmacy nearest to you, and the pharmacy delivers you the medicine. It's all connected environment. That is the very basic telehealth platform, and which is basically in India, some of the initiatives are already done, and there's still a lot needs to be done. Another very important area where we can use technology to improve senior care, chronic care, post-surgery care, palliative care, is that by improving the healthcare at home. So now even if we get sick and like we have to go to hospital. Now, if you see a senior care who needs like long-term assistance, right? It's not like 1 week, 2 weeks. He may need it for months and years. So there is a need to improve, set up something at your home, maybe with some sensors and something, and then the doctor is connected with you. So these are the very important areas where initiatives can be taken. So I am basically focusing on these two areas, where one is telehealth, another is healthcare at home. And these both, if we focus on this, it can really the reach of the healthcare will increase by fold, and the quality of healthcare will also improve because of the real-time monitoring of these conditions. Like healthcare at home, I mean, we already have sensors in our phone, we already have GPS, we have remote monitoring tools, we have big data technology, we have so all this, if you know these technologies, if somebody uses properly, I mean, they are very much possible that one simple project could be to just make your home senior friendly and with sensors track their movements, with sensors track their temperature, or with sensors you can track their heartbeat, and everything you can track remotely. These are the already technologies available, but we have to make this available in a way that it is accessible, it is affordable, and it is reliable. Medical professionals trust on this. That is the main thing. So now I'll just talk on some notable initiatives. Practo, I'm sure you must have heard of it. They started some 8 years ago, and they have basically, the first thing what they did is they listed the doctors on an online platform, so that you will be able to search the doctor in your area and make a booking. And they kept adding services, and now even you have your health records. If you have subscribed to Practo, so they give you the access to your health records. No matter which doctor you see, today you saw a doctor in Bangalore, tomorrow you see a doctor in Mumbai, or you see a doctor in Singapore, but your health record is accessible through Practo platform. So you log in and you will see your history and everything. So Practo is, I mean, with lots of struggle for last 8 years, but now they are really one of the prominent company in India and doing really good for the population. But still, the access to these services is limited to bigger cities. Forget about the rural India. This whole rural area is still needs to be taken care of. Another initiative is there is a company called Healthcare at Home. It's a UK-based company. They recently launched in India also. So they are actually saying that quality healthcare right at your doorstep. Again, they have launched the services in few metros in India, and they are going up to the extent that they can set up an ICU at your home. So whole ICU setup is done at home, and the doctors are monitoring you remotely. So this is what I'm talking about. Like when you have to have long-term critical care scenario. So if you are in the hospital ICU, you might be spending 20,000 per day. But if you are at the home with ICU, you might be spending around 7,000 per day, and yet getting the environment of your home. So that is very important when you are recovering. Like home environment is always much more favorable for your recovery. And now let's talk about some open source initiatives. One of the very good initiative in India is IntelliHealth platform. The lady is belongs to Mumbai, and she started when she was in Johns Hopkins University, and the structure is done so well, and this COVID situation, they really helped India to set up these platforms very quickly, because this like COVID time, India needed this platform because you wanted to get, so you were telling patients to call the doctor and get consultation, but there was no way other than WhatsApp and phone. But this IntelliHealth has already have a mobile application and also have a backend platform where doctors can log in and look at the cases and prescribe. And at the same time, mobile application is used by frontline workers, and they go to patient and then they connect the patient with the doctor. So this is very nice initiative in terms of telehealth for India, and they have implemented it in Odisha. So where they are like Anganwadi, like they have connected with the people in the village. So there is a lady who is given this kit. Okay, so that kit has all the basic equipments to measure your temperature, measure your blood pressure, measure a few other parameters. And there's a mobile application, and that every data is fed, and the doctor is connected with you there only in real time. So that is a very successful initiative in India. I mean, students must look at these kind of initiatives to learn what is happening. Then another initiative is GNU Health. GNU Health is again it's a basically health management system, hospital management system, and it has EMR, which is electronic management record. So all the health data is recorded. It also has laboratory management system. It has demographics. So it's a fully functional hospital management system and health management system, and it is so portable. It can be just installed on a Raspberry Pi and it can be used in a hospital. So it's that sorry, yeah. So this is and this was started by a doctor, and they have implemented this solution in worldwide, specifically in Africa, and even AIMS in Delhi have one installation of GNU Health. So it's these are the two very good initiatives. I would suggest all the students who are interested in digital health technologies, they should really learn this. They should contribute into these open source initiatives, and they will be much better prepared when they are looking for a job in the market. And even Codex also is doing the same thing. Codex is basically trying to explore these open source platforms and maximize the use of it, and also connect the expertise and students with this, and make them aware of these open source platforms and how can they contribute. So students can feel free to contact me if they are interested in any of these open source platforms, and I will be able to guide them further. Okay, I have one video to show you like how we can improve the healthcare initiative. I'll just switch that application.
This is the story of Mr. Jeff, a doctor who runs a clinic in Patna. One day, Bob, who lives in Patna, got a fever and went to meet Mr. Jeff. Mr. Jeff gave him some medicines, and 2 days later, Bob woke up feeling better than ever, all good, back to his great health. But one day, somebody called Harry got chest pains. He too went to see Mr. Jeff, but Mr. Jeff didn't know what his conditions were leading to. So 2 days later, Harry got a heart attack, and he died. What if these local doctors could communicate with expert doctors who specialize in different fields? An expert on video call in real time with the patient and the local doctor. How cool is that? Introducing Smart Clinic, which makes that idea possible. So now, Mr. Jeff can communicate with expert cardiologist, neurologist, pulmonologist, nephrologist, endocrinologist, and many more. Although Mr. Jeff cannot bring poor Harry back from the dead, with the help of Smart Clinic, he is saving more lives.
Okay, that was just so this is basically a concept which basically to empower local doctors in a village, right? I mean, a simple interface, and doctors, they don't have specialist doctors in the village, but we have a specialist doctor sitting in the like hospitals, big hospitals, metro cities. And if we can give them access to this doctor, then you can imagine the quality of healthcare, how it can increase immediately. So I have to share another screen. Just a minute. Okay. And I'm almost done in my last few slides. Okay, I want to bring your attention to healthcare in ancient India. You know, this is very interesting. So, in the ancient India, patients were treated in their home, in their own home. You know, there was no such concept that if you are sick, you have to go to hospital. So the doctors would basically come and treat you at home. And the thing is that is so why I'm bringing this is India for us, and we have to learn from our past what India already had, and why healthcare services function so nicely. So that healthcare in India, I'll read one more thing and then come back to this slide. See, there is a Chinese traveler who visited India during the times of Chandragupta, provides us with details about the charitable dispensaries in Patliputra. According to Fahim, the nobles and householders of this country founded hospitals within the city to which the destitute of all countries, the poor, the crippled, and the diseased, may come. Here, these people were treated freely and provided with every kind of help. After inspecting their diseases, and the physicians treated them with all their efforts, and when cured, they depart at their convenience. This was the healthcare, right? So basically, we had our healthcare system where everything was given free without the looking at your caste, creed, or your financial ability. So when and where did our country lost its old policies, culture, approach of the state and governance? Why we cannot again rebuild the care fabric based on our own culture, social values, and beliefs? Is it the Western world had been happy about healthcare being purely commercial? Are we doing justice to adopt an already failed and failing systems of healthcare delivery across US and the Europe? So with this note, basically, I will conclude. Let us get back in times when India had healthcare service delivery system based on its social values, where comprehensive treatment were given to those who needed without any criteria or parameters, where access to the service was not an issue. So this is what we should be learning from our ancient practices, and we should really make use of digital transformation, digital platforms, digital technologies, and digital health to improve our healthcare and access to basically we all should get access to good health where we live. It's not that we have to go somewhere to get good quality healthcare, which is currently happening in India. Thank you.
Thank you, Mr. Shankar. This was really scary, eye-opening. I don't know, this kind of mixed feelings right here that we have a failing system, but we still have hope. So I don't know whether to feel good that we have hope or to feel a little upset that, how could we ignore something as basic as healthcare, in our country. So I do have quite a few questions. So can I go ahead and ask the questions now?
Yes, please.
Okay, so the first question that I have is, how can one access, the accuracy and reliability of the medical reports generated through tele or remote mode?
Okay, so that was the point I also raised. So what happens is medical, it's a life and death situation when we are talking anything about health. So I will just share some example how the telehealth is being used in the US. So in the US, what happens is there is a big queue to just get the appointment with a doctor. So what they have done is they have basically opened this telehealth. Some of the doctors came up with this solution. And if you have some really emergency situation, and if you go to an emergency department where you have access to the healthcare, but they will charge you $300 just for the visit. So that's the situation they are using telehealth. Now, when we talk about telehealth, if I go in detail, so not every condition can be treated using telehealth, right? There are conditions. So, but there are still 60 to 70% conditions where a telehealth is very effective and can minimize the hospital visit. And also, like for example, follow-up visits can be completely minimized.
Yes.
In terms of reliability of data transferring, that is where the infrastructure has to play a very big role. We have to have good infrastructure, good network, good communication. And so, for example, this initiative of IntelliHealth in India, so what they did is they came up with a kit. So there in that kit, it's like a medical kit. Primary healthcare person is given that. So they are ensuring the quality of checkups. So they are trained. So basically, the mobile application which is given to them is an AI-based application.
Correct. So that was one of the questions that I had for you a little later. Yes, continue.
So what is happening? They are collecting the data, but the data collection is guided through the application.
Okay.
So it is not dependent on the person who is sitting in the front line. It is basically guided using the application. So they are again mitigating the risk of getting wrong data and wrong diagnosis.
Okay. So, is there any industry standard? I mean, you say this is you're saying this is reliable, but are there any industry standards that they have to follow, that the medical practitioners or the software or the platform has to follow?
Yes. So industry standard is there. So any device you use, there is a CE certification. If you know any medical equipment, if it is qualified medical equipment, it will have that CE certification. So if I say that my watch has temperature monitoring, but the doctor will not accept that data because it is not having the certification which is required to make your device acceptable in the medical professional. So yes, there is a certification and then process, and that's why if you are trying to build a medical device, the process takes very long time because the certification is very challenging because it is it's a matter of life. So that's why this is very stringent process.
Okay, so I'll take one more question. There are quite a number of questions, but I guess I'll take one important question that is here. That's actually from me. How safe is the patient's data? How safe is the records? Like you said, that last 10 years you don't have any records. If you have to go to a doctor again, let's say with something new, completely a new symptom, a rash on your skin. He or she, the doctor, has no access to your past records. Are you allergic to penicillin? Are you allergic to some kind of other medicines, or things like that? Then they start with that with one injection where they put a circle around it to check what you are allergic to and things like that. So, but how safe is a patient's data, especially when it comes to ailments or something which you really wouldn't like to be made public or something like that? How safe is the data? So today if I go to a hospital, my name is there, my record is there, my telephone number, my email IDs, these are all things which I share with the hospital at initial registration. How safe are they, or my records or my health condition safe on these platforms?
Okay, so let's see. What is happening, even if you're like now your data privacy is basically on a toss all the time, right? Like you're on social media, everything you expose in social media. Okay, then let's talk about banking applications, which are very secured applications. You would not know, but most of the banks in India are getting hacked many times.
Don't scare us. Please don't scare us. You know, we have enough scares in our life. The corona has created enough scare for a lifetime. But yeah, you know, that is one fear that we all have, that when your data is out there, how secure is it?
Yeah, I'm telling you now, latest technology. So what is happening with the change of technology? For example, there's a research going in the MIT using Bitcoin, using the
Yes,
cryptocurrency.
yes, cryptocurrencies.
Patient data will be stored in cryptocurrency.
Correct.
Now, that is the utmost security you can get. So
Okay.
the data is secured, the access to the data is secured. So access to data is given in terms of, let's say, if I'm going to hospital, so I can give you that hospital access for a limited time, and then again the access is revoked.
Revoked. Okay. So these you're saying it is safe. You're saying that it is possible to keep it safe.
Yes, with the development of technology and with the latest technology, if you see that how reliable the security it is, yes, we can certainly say that like earlier now we have better protocols, like if the data is traveling from one server to another server, it is secured, encrypted. So even if somebody hacks it, they get nothing out of it.
Okay. Okay.
Right.
So the next question that I have is, as rural areas, at least especially in India, they have poor, low internet connected accessibility. How does a digital or a tele mode help in treating the patients?
So that is where this I tell you, see, the infrastructure plays bigger role. At least now, like having no access to, they have access to internet. Maybe it's not so fast, not that quality, but if like in telehealth, what they do is smart system is, so the mobile app on the which is given to the frontline workers can also work in offline mode. So if
Okay.
let's say if the connectivity drops, but they can still continue to record the case, register the patient, and when the connection comes back, the doctor gets the report and immediately the prescription is given back.
Okay.
So these are the different, again, workarounds we have to understand the whole structure, how the India infrastructure is so fragile and how still we can make some impact with the technology.
Okay. The next question that we have is from Dr. Mohan, who himself has done, I think his not think, I'm sure, in the medical domain. So Dr. Mohan has asked, the telecare prescription is based on verbal or on any pathological or medical measures. Concern here is the wearable devices are not true biometric measures. I wouldn't doubt what he's saying here. You know, Dr. Mohan is done his doctorate in this domain. So yes, what would you say to this?
Yeah, I also said the same thing. So all the wearable devices, doctor will not accept any of this data.
Correct, correct.
Okay. Now, if you see the latest guideline given by Indian policymakers on telehealth practices, so one of the things they have made mandatory that every doctor has to go through a training program, and they get certificate that they are certified to conduct telehealth practices. This is
Okay.
so these are the kind of measures, and then they also have circulated a guideline that what are the different conditions you can prescribe medicines over telemedicine.
Okay. Okay.
So there are three channels. Like okay, if you are able to access the patient on video call, then what all you can prescribe. If you are able to access the patient just on phone call, then what all you can prescribe. Even they have come up with the list of medicines which can be prescribed over telemedicine platform.
Okay. So
So these
this process and this entire system has been ecosystem has been set in. That's what you're saying. It's already in place.
in terms of policy,
Yeah, in policy,
yes,
obviously,
yes,
but not obviously operational yet.
yeah,
But
no,
yes, as a policy, it will be there.
yes.
Okay. So the next question I have from a student who's Mayank has asked, how long will it take for doctors to get used to diagnosing from different format of data that is online, rather than ideal ways that they are accustomed to or they are trained to? In fact, that is a very, very good question, because doctors have to unlearn what they have learned in medical school, was checking the heart and pulse, and now go, try and do it on a digital platform. So how long do you think the doctors will adapt to this?
See, Mayank, it's a very good question. Uh, the thing is, even if you go to hospital, so nowadays what has the trend has become is that doctor will prescribe you certain tests, right? And then doctor will monitor certain parameters of yours. So getting those parameters, that is why the intervention, like one intervention in Pune, which we are planning, is to tie up with those people who are going to your home to collect samples.
Okay.
Okay. So if that same person can go when you are having a consultation with a doctor, so that person is equipped with the equipments to measure your parameters, vitals.
Okay. Okay.
So, see, I cannot rely on the patient for the data as a doctor.
Correct. Correct.
Right?
Correct.
That I'm saying, maybe if the patient is directly talking to doctor without any assistance, then I would be able to treat maybe 20% of the cases. But if the person who is going to your place to collect blood sample and he has been trained to collect the vital parameters, then my treatable cases may increase by 60%.
Okay.
That
Because
is,
it becomes a reliable data.
yes. So those are the kind of interventions which are like, it's not like, okay, there is an entrepreneur who develops a mobile app and says, okay, this is a telehealth platform. No, we have to really come up with smart interventions and make it reliable so that patient can have trust and doctor can also trust on the system. And then when we see we cannot eliminate face-to-face.
True. True. Absolutely. That is not possible. Correct.
Yes.
Okay, so the one last question that I have is from again Professor Ashwini Jarali. Why don't Indian doctors believe in Ayurveda? So, what has been your experience? What has been your kind of exposure to it? Because you've been dealing with doctors and the medical domain. So, what has been your take?
Yeah, this is a very interesting question, and it can be like we can talk on it for pretty
For
long.
long, yes.
Yeah,
Ashwini ma'am, probably will have to get in touch with Mr. Siddharth, outside the webinar to actually get this answer. Because, I guess we need, like you rightly said, because Dr. Mohan has also says a great thought that we need to bring back, our ancient medicine, the ancient practices that we had. Maybe blend it with technology or come up with something that can work. Both can work together. But I guess yes, we should actually try to do something in that domain. Okay,
I'll just share one example. What is happening is now, if you see, we have forgotten our yoga practices.
correct.
But in the Western country, yoga
They
has
are coming
become.
back to you. Yep, yep.
Another example is, that like delivery, like birth process. Now, home delivery is an elite service.
Service, correct.
And in
Yes,
India, we had it.
we had it. Yes, we had the daima, we had the midwife coming home to do it. Yes,
Yes.
true. Yeah, now it's considered one of the a very high class kind of a service where I deliver at home and I have a team of doctors and nurses coming home to them. True. So I guess we are going back, the circle all over again. But
Yes.
okay, now when you're speaking about health in this last 1 hour, whatever you have spoken, everything has to do with the conditions which are critical. Let's say heart, the physical body as such. Um, I want to know, where does the mental health feature in this digital platform? Because um, I mean, you're hearing a lot of cases of people getting into depression. This is being locked down. There is tension. There is all kinds of, mental disturbances that are there. But very rarely you find platforms or services that provide mental, treatment on, because I guess that's the easiest thing to do. All that you need to pick up a phone and speak to the doctor and say, today I'm feeling depressed. or whatever, but I don't see that anywhere. Most of them talk of your heart, your lungs, your BP is high and your pulse rate is high and okay, all this kind of. So how do you suggest we include the mental health?
Okay, I did not touch upon that on detail, but just to share with you, most successful telehealth platform in the world so far is basically one which is dealing with mental health.
Yeah, okay. In
And that
India,
is
are you talking in India or the world?
no, in the US.
Okay.
Problem in India is not about the platform or technology or but it's like social stigma
Stigma.
kind, right? We first of all we will not accept ourselves that I have
True.
some issue, and even if I accept, the whole society will not accept that I have some issue and I
True.
need us.
True.
But there are initiatives, and there are platforms available. Uh, but it's a very basic level where you can just call and get support.
Counseling.
Yes, but in India,
Okay.
you see how many people will really out of 10, if you tell that you should take counsel, they
Yeah,
will
yeah,
just
yeah. Oh, yes, absolutely, absolutely. But I guess it needs to start somewhere. I guess it needs to start at some place, because we are moving towards requiring medical support. I mean, mental support in terms of our mental health, whether we like it or we don't.
correct.
It is definitely there. So yes, okay. So that was really a very nice session, and I have a very nice and warm message from Aruna Katara ma'am for you. So let me read it out for you. Thank you, Sid, for this informative session. Young educational institute as ours have greatly benefited with industry academy or associations with companies like yours. We look forward to our students gaining from your guidance, which will be of great value addition to a student's career. So this kind of association, the partnerships that we have with industry, I guess eventually it's the students who will benefit, and I'm sure there's a lot of work that can be done by the students and can help them with their career as well. So that's the message from Aruna ma'am, and on behalf of all of us at I Square IT and PPCRC, thank you so much. Thank you so much for joining us today and having conducted this webinar for all of us. Given us a lot of things to think about, a lot of things that we can contribute, we can take help and support from. So thanks to you, thanks to Rajesh and the systems team for connecting and making this webinar happen.